Welcome, everyone, to this webinar on climate change and mental health 101. I'm Selin, and with Bronwyn, we will be facilitating this session today. And this session aims to provide introductory information and insights from experts who work in the area of mental health and climate change. And we will have time for questions at the end. So if you have any comments or questions, please write them in the chat. I would like to thank you very much, Ale, for organizing this webinar, and all the speakers for their time and contributions, and for everyone for being here joining us today. And one last reminder is that the session is being recorded. So our members who are not able to join us today will be able to watch later. So maybe we can start. Our first speaker is Dr. Emma Lawrence, and she will be telling us about climate change and mental health, a global overview.
Wonderful. I hope I had some technical issues earlier. The audio is coming through brilliant. Thanks so much, Ale, and thanks for going through the slides for me. If you can go to the next one. So I will try and cover a bit of how the climate and mental health field currently sees the evidence for the impacts of climate change on mental health, and touch very briefly at the end on some of the many possible benefits of climate action for mental health. But so why should we care? Climate change is a risk multiplier. So it's not necessarily creating new conditions for traumas and stresses and poor mental health, but it's exacerbating and multiplying the risks that are already being faced, and its consequences will undermine progress unless fully addressed. But also, as I said, there is a huge synergy between the conditions needed for good mental health and well-being and what we need to do for climate action. Next slide, Ale. So there's a sorry, I'm just toggling between devices with these technical issues. So there's a whole continuum of ways, of pathways and mechanisms where a changing climate and rising global temperatures are worsening mental health outcomes. Just to touch on some of them, people are experiencing more direct impacts on homes and property, direct experiences of extreme high temperatures and more extreme weather events. There's then flow-on effects to damage to livelihoods through crop and livestock damage and food and water insecurity, forced migration, loss of habitats, changes to livelihoods, communities break down, health systems, education systems are disrupted, and then people witnessing these changes to their homelands, having their homes change in profoundly negative ways, and hearing about this as well through news or through other sources. Next slide. And all of these things lead to, sadly, a range of worse mental health outcomes. We're seeing across the literature that there can be higher risks of suicidal thoughts and deaths by suicide, new cases of diagnosable mental illness, more susceptibility to physical ill health or death for those with diagnosable conditions already, so exacerbating underlying conditions, and worsen population health and emotional mental well-being. And this is increasing the mental health burden already, but it's also predicted to escalate with the ongoing impacts of a changing climate. One estimate has put the compounding nature of more climate hazards, air pollution, and lack of access to green space will cost an extra nearly 50 US billion per year by 2030, accelerating to over 500 billion per year by 2050 for this extra mental health cost. If we go to next slide. So climate change is worsening mental health conditions through more traumas, stresses due to extreme weather and climate events, but also disruption and undermining of the conditions needed for good mental health. So the promotion and prevention conditions can be eaten away at through the impacts on livelihoods and social connection, forced migration, etc., etc. But this also interacts with awareness, which can increase distress, which can worsen mental health and well-being, but in ways that are still not completely understood. And physical health impacts of climate change, it's notable that there will also be a mental health consequence of that. So we saw this with COVID, when we have increasing spread of infectious diseases, for instance, or malnutrition, there's going to be impacts on brain and mental health. Next slide. And of course, none of these things happen in isolation, and I'm sure you'll hear examples of this from Turkey and Australia. But what we're hearing from people around the world, I led something called Connecting Climate Minds, also with people on this call. And this is just one example of what we heard in dialogues around the world. Every season is different now, unpredictable. The harvest is going down every year. They start cutting trees for charcoal as a coping strategy, but it makes it worse. A lot of depression, hopelessness, and a feeling of not knowing what to do. A lot of trauma. Many talk about suicide and fatigue from farming, connected to lack of sleep, body changes from depression. They isolate from their friends as not coping well. They cope using substances. And so you can see that both the mental health outcomes here and the causes are very interconnected, and there can also be, and multiple, and there can also be this kind of vicious cycle that happens. So I'm just going to touch on, for time, a few of these kind of pathways and impacts, but just to touch on the fact that there are multiple. So with rising global temperatures, both in terms of changing baseline and also more frequent extreme heat events, we're sadly seeing a rise from epidemiological evidence in an association between higher temperatures and the burden of suicide. So this is data from China, where with rising temperature, or across the board, if you have days of higher temperature, they see a higher burden of suicide death. If we go next slide, a systematic review and meta-analysis I conducted found that this is a few years ago now, and there's more literature, but at the time, suicide risk with increasing temperatures above a local baseline, so non-optimal local temperatures, was associated with a 1.7 degree increase per 1 degree increase in daily mean temp above that local baseline, and a 10% higher instances of hospital attendance for psychiatric disorders in heat wave versus non-heat wave periods. And also we see worse sentiment or mood, or it's measured in many different ways, but essentially with higher temperatures or non-optimal temperatures, we see poorer population mental health and well-being. And also people living with mental health conditions are among those most likely to die due to extreme heat, it appears. So for instance, in Canada, in 2021, schizophrenia was associated with a higher risk of death than any other chronic disease in their heat dome event. And we've seen this in other data as well. So for instance, in the UK, a survey of people self-reporting on their experiences of heat over the last years and heat waves, people with an underlying mental health condition were most likely, and even more likely than people living with other physical health conditions, to report that the heat had affected their health negatively. And there's many different ways that this could come about. Wellcome's funded some work on pathways and mechanisms by which heat affects mental health. But if we, oh, sorry, Ale, I realized I hadn't told you to change the slide. And yeah, if we go to the next one. And also we see that rising temperatures erode human sleep globally as one pathway and mechanism, but there are many possible others. If you go to the next slide. So we see that with changing temperatures, there's physiological changes. So the brain changes in terms of how blood flows, in terms of cognition, and we also see poorer sort of school performance, work performance. We see that people are more irritable, there's more violence in general, including sadly domestic violence, which then has its own mental health impacts. There may be interactions with medications people are taking, and a whole range of other things in terms of people stopping their normal activities, such as exercise or spending time outside or with friends. And if we go to the next slide, we see that this also happens unevenly. So the ways that people have to adapt to things like heat depends on where they live, whether they're under the urban heat island effect, whether they have access to green space, to air conditioning, and it's often poorer communities who are in more densely packed housing without access to air conditioning, etc. And we see that this also affects different groups of people differently. So again, from Connecting Climate Minds, we heard about how children, for instance, and are having their education disrupted. Young people were saying that they can't go and do their normal activities, and this is also having a vicious cycle on their mental health and well-being. Next slide. And also to say that this doesn't occur just in the moment, but for all of these impacts, there's temporal effects to take into account. So there's in the moment impacts on mental and brain health, but also chronically, we're seeing that, for instance, if children, even in utero, are exposed to, or in early life, are exposed to non-optimal temperatures, that can have lasting changes on the way that their brain develops. Again, this is emerging research. If we go to the next slide, this also interacts with things like air pollution, which happen from burning fossil fuels, but also from wildfires. And there's interactions of heat and air pollution. And sadly, we also see with air pollution, this can have immediate, but also delayed and accumulative life course effects. And we sadly see increases in suicide risk on high air pollution days, but also people exposed to air pollution are more likely to use mental health services and to have anxiety and depression. And exposure during childhood, again, can increase risks of schizophrenia, neurodevelopmental disorders, and also neurodegenerative disorders in older adults. Next slide.
Just flagging, Emma, you've got zero time left, but continue.
Okay.
You're soon to finish. Yeah.
Yes, I will and hurry up. So just to say, Superstorm Sandy in the US is just one example of extreme weather events. I'm sure we'll hear more from others, but also to note that this exposure in utero also has long-lasting effects in emerging evidence. Next slide. I'll just quickly note that there's much more to talk about here, but also to note that awareness interacts with these experiences, and it is people who are in poorer and more vulnerable communities and people who self-report direct experience of climate change who are most affected by things like eco-anxiety. And just to note, next slide, that these all interact in ways that we'll hear about, but just to again note that these are not isolated disasters, but overlapping and compounding events which are accumulating people's risks. And this all sits, next slide, within a wider context of all the other changes that are happening where there's common causes and also consequences of a changing climate interacting with these other wider impacts. Next slide. So what is possible? Just to note and just to end that there is increasing and sufficient evidence to act on how climate change is a risk multiplier for mental health, but there is also a huge opportunity here to create the conditions for good mental health and well-being through climate action, and also to embed emotional and psychological, social resilience as key parts of creating a climate resilient society. Next slide. And just to finish, so there are a whole range of ways that this can be done, and growing evidence on how reducing air pollution, increasing access to green space, improving the energy efficiency of housing, walking and cycling facilities, strengthening social connections, etc., all improves mental health and are key aspects of a resilient society for a changing climate, and also part of the transformation we need. So I'll finish there, but if you just go to the next slide, Ale, just to note if anyone wants to know more, You can look at the Connecting Climate Minds Global Online Hub, where there's a lot of information, case studies, lived experience videos, and you can sign up to connect with others. And I'll pass back. Apologies for going over.
That was beautiful, Emma. Thank you so much. And hopefully people are taking notes and questions down on their notepads, and we'll have some discussion time after, and we can always go back to particular slides if we want to discuss them as well. Next, we have Fiona Charlson. Thank you so much, Fiona. Over to you to talk about the impact in Australia.
Thanks, Bron. Emma, I don't mind that you went over, because you covered quite a bit that I don't now have to cover. So I can just jump straight into the Australian context. Seeing Emma finished with presenting a lot of the epidemiological research, I'll start there. I don't have slides, by the way. I can share this information afterwards, and it's being recorded, so that's good. Australia was one of, I would say, has kind of really led the charge early on in epidemiological research around mental health, and, you know, going back a bit where we still sort of thought of these extreme weather events as natural disasters. Excuse me, I've got a cold. So we've got a long history of looking at mental health outcomes and large surveys in the context of isolated extreme weather events. And an example of that a lot of people on the call might know about is the Black Summer bushfires. And then as the field sort of matured a little bit, we started getting this and started thinking about climate hazards more broadly. So now sort of thinking about these natural disasters actually being climate related or climate driven. Some of the early research really tried to pick what I call as the low hanging fruit, and it lent on administrative data or frequently hospital admission data, and linked weather events to hospital admissions. So we got some really good early data. And when I say early, it's only a decade ago, maybe. So not that far back still, where we got some really good data looking at hot days or heat waves, and clear increases in psychiatric related hospital admissions, and a number of other sort of hospital admission related outcomes and other weather events. But now we're really moving into a much more sophisticated space. So we're looking at much more sophisticated analyses, methodological approaches of single, and what's exciting is we're now getting research looking at compounding weather events, which, as everyone on this call knows, is the new thing for in the climate crisis, where we're getting rolling events that are not single and isolated anymore, but communities are experiencing one or more at a time or back to back. And these studies are using some really large population-based data sets in Australia. And we're even at the point where we have multiple studies that are looking at the same research questions. So, for example, Matthews 2019, and also Lee and Leppold in 2025. Sorry, I'm just going to get the right screen up here. Have used a HILDA survey, which is a longitudinal panel survey in Australia. It looks at lots of data variables, including income, lots of demographics, but it does have a mental health measure in there. And they have looked at multiple repeated climate disasters and how that impacts mental health. They have used different approaches to analysing the data, and they've come up with different findings. Then they don't antagonise each other, they don't contradict each other, but it is really interesting that we're now entering this really sophisticated space where not only are people exploring new data sets, but there's new ways of people are really starting to push the boundaries of methodological approaches. And just to sort of give you the byline of those, one of the studies uses a causal inference approach. Another one uses a bit more of an advanced quasi-experimental analysis. And the first one shows that multiple disasters matter, that there is an increased mental impact on negative mental health. But the one that I would say is a more sophisticated analysis shows that mental health progressively worsens after each climate event. It recovers less and it becomes more unequal over time. So it really kind of gives this detailed picture of those cumulative and long-term impacts, which is the story I think that we really want to be able to demonstrate, because we all have sensed it, but now we're getting the data for it. So that's kind of exciting. In terms of intervention research in Australia is still very emerging, as it is across the world. There are some outputs from a recent funding round here from the Australian government that I'm hoping we get a little bit more evidence, robust evidence from, but we still don't have any evidence from these compounding climate events contexts yet. So lots to be done. Research in subgroups or populations that we think are more vulnerable to climate hazards. It's a really rapidly growing area, but most of it is, I would say, exploratory. It's qualitative, and a lot of it has methodological limitations, such as self-selecting samples. But it is exploring these experiences of these subpopulations, such as rural communities, farmers, and even psychologists. So there's a body of research there from Australia, but by far the group that's been researched the most is young people. There is a wealth of studies from Australia, and I know globally, and a number of people on this call are involved in this research. So a lot of it describes the prevalence of climate anxiety, for example, or worries related to emotions related to climate change. Existentially, it describes young people's experiences, and there's actually some really nice research coming out now that is based on psychological theories, which is really looking at adolescents' ability to develop adaptive coping strategies. So now we're really kind of getting into understanding how we can help young people. I'm just going to go back to what was the beginning of my presentation and just talk about the policy landscape in Australia. The cornerstone of policy, mental health and climate change policy in Australia is our first national health and climate strategy, which was launched at COP28, I think it was. And there is a dedicated mental health chapter or section in that strategy, which is fantastic. We want to see more, but it is fantastic first step, especially given, you know, on the whole, mental health gets neglected in many cases. So there's two actions specific to mental health in that strategy. The first is to promote mental health and social connectedness. And the second one focuses on building workforce capacity, specifically around mental health related issues such as awareness and ability to recognise impacts and appropriate care, etc. And then there's a number of actions that sort of implicitly have mental health embedded within them, such as strengthening primary care. Other things that have happened at the federal level in Australia, because we are a federated country, so we have federal and then state and local governments, each with their own role in relation to mental health and climate change. So federally, they, which is related to action 6.4 I mentioned around promoting mental health and social connectedness. They put that in the strategy and then thought, oh my goodness, we don't know what to do about that. So they released some research funding, which through the MRFF scheme, to support research into scalable and sustainable interventions that mitigate the impacts of climate change on Australians' mental health. that is, I actually don't know if they've been announced yet, probably just announced the awardees of that. So hopefully that will give us some good research around interventions, which I mentioned is a huge gap. The Australian government, or our CDC, has developed some guidance tools for health service organisations to undertake climate risk assessments and develop adaptation plans. So the key words in there for me is health service organisations. Policy in Australia at the moment is very focused on the health system. So we want to, I would like to see that broadened out beyond what can the health system do. Australia is also committed to publishing an HNAP as part of the strategy. Just a couple of things of note as well. There is a framework for collaborative action on climate and health, which is being established through a health college working group, including 26 medical, nursing and midwifery and allied health colleges, to develop this framework, to develop low emissions models of care and mobilise and support the health workforce. So obviously, because the health colleges, it's very health system focused, but that's a great initiative. In terms of mental health, maybe others can speak on the call, can speak to the representation of mental health colleges in that initiative. And probably the last thing I'll mention is that, and I'll pop the paper in the chat after I've finished talking, just I think a couple of weeks ago, our paper on mental health and climate change policy in Australia, policy review at the federal and also the state level, was published. We did a full deep dive into all policies across the national and state. We ended up looking at 25 of them. Policies related to climate change, mental health and climate health domains. We did a thematic framework analysis. We looked at how those actions or commitments or even mentionings in many cases were classified into sort of whether they were about awareness, just sort of acknowledging that this is the thing versus actually doing something. You can probably guess that there is not a lot of commitment to action. The other key findings of the policies are really fragmented and poorly integrated. Climate policies mention health but rarely mention mental health specifically. Mental health policies in Australia, which are at the state level, rarely mention climate change. They will often mention disasters, but not climate change. Only 7 policies out of the 25 had any concrete actions, and when there was many, very few. Climate health policies were the most comprehensive, but there was only a few of them. That main one obviously being the National Health and Climate Strategy. Yeah, I guess the takeaway from that paper is that policy responses are really inadequate in Australia and still need a lot stronger integration and action. I'll leave it there.
Thank you very much, Fiona, for your wonderful talk and insights from Australia about mental health and climate change. Now I would like to invite Dr. Burçin İkiz for her presentation on climate change and mental health in Turkey.
Thank you so much, Selin and Alef, for organizing, and Isabel and Ron for organizing this webinar. And it really gave me a wonderful chance. I really appreciated thinking more, doing a deep dive onto where we are in climate and mental health research in Turkey. And it gave me a lot of information doing that deep dive. So really appreciate that opportunity. I feel like one of the really great benefits of this STAG for me has been connecting with the wonderful colleagues we have in Australia, Pacific, and in Turkey, and thinking about what we can do in Turkey about this intersection. So thank you so much, and also for my Turkish colleagues here who are here today. It is a happy Eid to them. It is a national holiday, and they're here. I really appreciate that as well. Anyways, thank you so much. Next slide, please, Ale. I had added the slides, but maybe I think
Let
in the
me
most
just
recent one,
refresh.
I added it. I added it super late. I'm very sorry, Ala, about that.
No worries.
Here are my slides.
You know what? It's not. I can see them. Let me quickly re-enter the link and then reshare. I
Sure.
think
And if it doesn't happen, I can share my slides then. Sorry, it was very last minute.
no worries. Let's try. This should work, I think. Slideshow. There you go.
Perfect. Thank you. So I wanted to just maybe start with the geography of Turkey to really acquaint what's been happening, what we see in terms of how we are experiencing climate crisis in Turkey. We have Mediterranean climate overall, but it is very intersectional. So on the western side and the southern side, we have the Aegean and Mediterranean Sea that sees the more of the milder Mediterranean climate, and on the east and the southeast part is a lot more drier weather, very desert-like, and in the northern part is very rainy. That sees the Black Sea region, and it's usually very rainy, very green. But for the due to climate change, these patterns have been changing. This is a study from last year that showed that even within 20 years, there has been quite a bit of changes in the climate patterns. That the rainier parts in the northern part had been becoming very strong rains, very limited times, causing a lot of flash floods. The temperatures have been rising across the country. So, and over the 20 years, as you can see, it turning red on the right side more and more as the years have passed, and causing a lot of desertification. There has been more than 80% of the natural disasters in the last decade were linked to weather and climate extremes. And that says a lot because it's a very earthquake-prone country, and we do have a lot of earthquakes, which is obviously another climate-related event. So having 80% actually being due to climate events, that tells a lot how much the toll on the country is in terms of the extreme weather events caused by climate change. And we have been seeing this shift in the weathers, just similar to what Emma had explained. The seasons have been changing with abnormal winter heat and unusual summer cold spells, and temperatures are rising. And in terms of the effects of climate crisis, we see experienced most heat waves, droughts, wildfires, and flash floods that are causing the most burden on this region. Next slide, please, Ole. So I tried to look into first putting in the search terms of climate and mental health in Turkey, and I found very limited literature. So I tried to expand my search into looking into more of the direct impacts of these climate-related disasters, looking into words that include wildfires or floods, looking into drought and mental health, looking into and then looking into more climate distress and eco-anxiety, and I'll be sharing with you what I have found from those searches. And unfortunately, it has been really what I have found that there's very limited literature, limited studies looking into these aspects of mental health, which is disappointing, but it also gives us a great opportunity, knowing what we know from our Australian colleagues, and Fiona and Emma gave such great overviews of where the field is, and so in thinking about those, I've been giving us great ideas of what we can do about these big knowledge gaps in Turkey. Next slide, please, Ellen. So when I looked at the direct impact, one thing that struck me was this study that just came out about a month ago or so on the 2021 wildfires. So in this west and southern region of Turkey has been experiencing wildfires ever since I was a child growing up in Turkey, and it has been getting more and more frequent over the summers. In fact, last summer, the summer house of my aunt in the western part of Turkey where we grew up burned down completely. Yeah, thank you. And it's, it happened exactly when we were a couple months after we experienced the LA fires where I used to live. Anyway, so it shows about how this is global, really. And really realizing that these fires are becoming more and more frequent and more damaging. And in 2021, Turkey experienced really the largest wildfire disaster in its history, kind of similar to the Black Summer that was experienced in Australia, affecting 500,000 people. And there were multiple hundreds of fires going on at the same time all over the country. And Turkey is a big country, so having it across these different regions was really detrimental to the populations. And then this study came out just a couple weeks ago, showing that these wildfires in the regions you can see in orange that had experienced the worst fires had increased likelihood of experiencing post-traumatic stress disorder and depression 6 to 8 months after the fires. This was not followed up years later, but we know from the studies that it looked very similar to the studies we have done with our group members in Neuroclimate Working Group looking at the wildfire impacted communities in California and in Hawaii, that these impacts on mental health is not just acute, it doesn't happen within just months, but it really persists and can become even more deeper after a certain months go, even after a year or 2 years, including cognitive impairment in many of the impacted individuals. And of course, there's more groups, populations that are much more sensitive to these impacts. And so in this case, in this study, it was the women, students, young adults, and economically affected groups had significantly higher mental health risk. And we know that from other studies done in different regions too, and which Fiona had mentioned also, these repeated, and since these wildfires are happening every year now, these repeated exposures to can really make these impacts much deeper, much detrimental to the individuals as well. One thing that was interesting in the study showed that watching actually the wildfire coverage through media was linked to PTSD and depression, similar to what actual direct impacts of the populations. And yeah, that was very shocking, and also shows that how we have to really pay attention to these secondary exposures of these kind of events as well. Next slide, please, Ali. So there had been in terms of the public climate awareness and distress, there was a recent study that was published last year from the Pew Research Center where they looked at about 25 different countries, middle-income countries around the world, and Turkey was one of them. And they had found that the perception of climate change as a major threat had surged to 70% of the population that I have talked to, and approximately 82% of these people were reported to being very or somewhat concerned about the personal harm resulting in this change over their lifetime, which really shows, I think, and then this was repeated through some of the surveys, more informal surveys that were done within Turkey context, and just shows how much there's, especially among young people, not surprisingly so, the awareness has been really increasing on climate change, and with the awareness comes the distress. Next slide, please, Ali. In terms of looking at more vulnerable populations and their feelings, I couldn't find too much quantitative studies, but there were a couple of qualitative studies that really elevated the youth voices on climate change and mental health, and that I wanted to highlight here. So these two studies showed that young people see climate change through through the disasters that they cause, and they related to the fears about the future. And especially for youth that is experiencing other psychological disorders such as depression, have shown nearly double the eco-anxiety levels and greater pessimism about the future, which is not surprising, but also again something to think about how for especially I think for healthcare professionals, for parents, for caregivers, for being and supporting young people who are already have existing psychological conditions, to think about how we can support them and be able to support them in terms of their feelings around climate distress as well. And higher eco-anxiety was linked to greater climate engagement, so that was really promising, and it's very related to some of the studies we have done looking at the neurobiology of eco-anxiety in the US. So actually they were able to, when they were able to given the opportunity to act on their feelings and through collective climate action, that was very beneficial for their mental health. And both of the studies from the voices of the youth really emphasize how important it is that the messaging, the climate communication, has to have some balance. So it shouldn't be just terror and fear and bad things happening, but also give hope and agency, which I think is again a very important message for us thinking about in the studies we do, in the impacts, thinking about the interventions, thinking about the hope, and thinking about how we can bring collective community action, climate action, especially for young people. Ale, next slide, please. I looked for climate distress across other vulnerable populations. One of them was pregnant women. There was a small study that was done reporting that pregnant women showed greater climate anxiety and future-related concerns. This doesn't surprise, of course, as they're having children, they're worried about their future, but they had found that hope would support resilience and action for them as well. There was a study published very recently looking at the healthcare professionals' awareness, and found that 42% of professionals say that climate emotions affected their daily life. And then I tried to look for really any studies that have been done with the other vulnerable populations, such as farmers and fishermen, and I couldn't really find any studies, but found some media coverage and interviews stating again how worried farmers are. So, for example, in central Turkey, due to the worsening drought, the groundwater depletes, and it creates these giant sinkholes. There's some really disturbing photos. You can see these giant sinkholes happening that destroys the farmlands and really affects the livelihood of a lot of farmers in central Anatolia and the Mediterranean regions, and they create a lot of concern and fear among the farmers. But formal studies really lacking on elevating voices of these individuals and populations. Next slide, please, Ale.
Gretchen, sorry to interrupt, because this is absolutely fascinating. Just letting you know that you're at time, but take a bit more time. But
yeah. Absolutely, thank you. So the in terms of where we are, I think there's a lot of knowledge gaps in this space. The climate mental health research is really limited, especially looking at more vulnerable populations, and looking into more those combined effects, or beyond how people feel. And of course, a lot of desire for hope and resilience and action and agency, but not much conversation, especially in the policy space and so on, in interventions or any conversation that relate to climate and mental health. Next slide, please. Do I have a next slide? Oh, yes. And so I would just want to highlight some of the work coming from, and thanks to Celine's leadership on COP31, STAG Turkey has been really thinking about how can we address these knowledge gaps. And so we're working on it now a systematic review, looking at the existing scientific literature to really understand the landscape we're dealing with, case studies with farmers and fisher populations, which we want to turn it into a combined climate and mental health report. Very inspired by our colleagues in Australia. Sibel, I'm thinking about you for those amazing reports you have created, and also creating some youth seminars and statements, and a survey among mental health practitioners. So thank you.
Whoa, taking a big breath. That was amazing, Gretchen. Thank you so much. We're now moving on to Litiana, who is going to be speaking about the climate mental health impacts in the Pacific. Over to you, Litiana.
Are you all able to hear me?
Beautiful, we can.
Perfect. Thank you so much. So mbula vinaka na itango Litiana langin balavu o nganele anikande korlo mai viti na te neto ikana ikatu neto kau na uto vatkena neto manman na beka. So my name is Litiana langin balavu. I am from the province of Lomai Viti in Fiji. Our totem fish is the ikatu. Our tree is the breadfruit tree, and our animal is the fruit bat. And I just wanted to introduce myself in this way to kind of set the tone or the foundation of how we Pacific Islanders view our natural environment. They to us are kin. So when we have, say, a totem animal like the bat, that means that we protect them. We're supposed to be living in synergy with them. And so so the climate crisis as an assault on our vanua and land to us is a direct assault on ourselves, on our family, on our vanua. And so I also want to say that I have worked around the region. However, on climate and mental health, most of my focus is in Fiji, and I also want to make it very clear that the Pacific is very diverse. We've got hundreds of languages, hundreds of cultures, and also that the experiences around the Pacific are very different. Parts of the Pacific have experienced nuclear dumping in their regions, and some others are more prone to cyclones and others to flooding. So the effects, the way that climate change affects our region in some points are similar, but also it can be very distinct across the region. So I guess to analyze climate change and mental health in the Pacific after setting out that relational framework that we have to the Vanua. So our state of equilibrium depends on this, and I think to kind of ground this, I want to bring in the example of tropical cyclone Winston, which rummaged through Fiji in 2016. The economic effects of this and how much it cost the country, almost $0.71 billion, greatly documented. All these things were the physical and economic impacts were well documented. However, the mental health and even just generally the general health effects of this cyclone were not at all. And so I do have some studies that I wanted to share with everybody today, and maybe I can send those studies across to Alessandro, and perhaps when you send out the recordings, you can send through these studies as well. And so there was a study that was done last year and published in the Journal of Indigenous Social Development. It was this study was done by solely Indigenous Itoke scholars of Fiji. The names are Raisele Malakaiwanga and Rosiana Langi. And it mapped the deep psychological and ontological wounds left behind by these compounding ecological destructions or degradation. So in that study, they used, and this is very important, especially when approaching the region and going into grassroots and frontline communities, they used culturally sensitive methods of research. So what they used in this study was Vitalanoa, which is like a multi-log, which is like a Talanoa, but with everyone involved, youths, elders, men, women, people living with disabilities. And so with this framework, they investigated 2 communities that were experiencing acute sea level rise. And so in this study, they confirmed that climate change triggers solastalgia. And I had never heard this word before until last year. I've heard of eco grief, I've heard of eco anxiety, I've heard of nostalgia, of having lost something and thinking back on it. But this study highlighted the solastalgia that Pacific peoples are feeling, and specifically these communities in Fiji. And solastalgia, according to this study, is the acute mental distress caused by the unwanted transformation of one's home environment while you're still occupying it. Yeah. So, and together with solastalgia, they noted, of course, pre-traumatic stress. So just chronic amounts of anxiety. So they can feel a little rain coming in the morning and they're already going crazy, trying to put up shutters. So and they labeled this pre-traumatic stress. So it's just, and it's that, right? It's anticipatory anxiety. And I think also a lot of that would have to come with the distress of potential relocation. So in the last 12 years, 6 villages in Fiji have already been relocated, with about 40 more planned to relocate. And that's just Fiji alone. The numbers would probably double or triple if we look at the entire region. So in this study, they were finding that severe coastal erosion, saltwater intrusion, inundating the homes. The sea level rise was also causing the farmlands to get poisoned. So it was affecting it was affecting their food supply, their food security, and so another added level of stress, another added level of distress, having to worry about what they're going to eat the very next day. And so in this research, these types of psychological trauma culminates in what they had defined as ontological insecurity, which is the profound erosion of the material, social, and cultural continuity, which establishes a person's baseline sense of order, their stability, their meaning in the world, their purpose, who they are as a person. And I think what I also wanted to highlight is that these conversations are almost never had. It's I don't know if that's just a cultural thing, but we don't really talk about our feelings here. We just get on with our lives. We move on. We get up. We go to the fishing. We go to the farms. We go to school. We go to work, and you move on, right? And which is why I'm so grateful to be invited here and to be having these conversations with all of you, because this is something I have been thinking about in the last few years, is how to bring these conversations more into the climate space, because it's all connected, right? The planet's health, our health, and us. When I say our health, we are a holistic, mental, physical, spiritual being, right? Like there's levels to being a person, and these are all continuously affecting each other. Another thing that I wanted to highlight from this study was the way that the communities, like I said, even though they don't talk about their feelings and that they're going through these things, they have ways, the ways that they move in order to kind of tackle the issue and to fight back with the issue. And what we've seen is increased community gatherings, like increased coming together of having intergenerational gatherings, which wouldn't normally happen. Usually the elders don't really talk to the youth and all of that stuff. But after a crisis, people tend to gather together more. Like they come together more. They want to be in each other's space. They want to be in community, and they want to, I guess, kind of feel safe, because that's the only safe space when the world around you is kind of falling apart. Yeah. So that's also something that the study highly noted. So my background is I work for a youth NGO. So I work mostly with young people. And in Fiji, the population is almost half indigenous and half Indians, Fijians of Indian descent who were brought in during British rule in Fiji. And so a lot of our frontline communities as well are not just indigenous Fijians, they're also Indo-Fijian communities. And what I've done, or what AFG has done in a lot of its work, especially when we go into the villages and rural areas as we go conduct our work and talk to frontline grassroots people, what we've done is kind of weave in some of our Indo-Fijian families methods of tackling mental health issues, for example, like breath work and breath-centered yoga. So we try and incorporate some of these things. We change the names around. But what we try to do with our workshops and our programs is weave in these things to kind of help the people who have just experienced trauma to kind of digest what they've just gone through. Because I guess the thing with trauma is, and I guess all of us here agree that this is traumatic event, right? That the climate crisis is an intergenerational traumatic event that's occurring to all of us as a species, as a planet. And so what we want to do is try to weave in these methods to kind of help people digest what they've gone through, and perhaps after having done that, they can get a clearer sense of what to do next, a bit more clarity of mind of what they want to approach, who do they to, all of these things. And then I guess I don't know how much more time I have left. And
You still have some time, Litiano. You're almost at time, but we've got a bit of space. So
okay, and I also wanted to share another way that the Fijians of the Pacific is showing resilience is this word in Fiji we call Sole Solevaki. So Sole Solevaki means when there's an issue, everyone comes together to try and resolve it. And so even if it's just a certain province that got affected by, say, a cyclone, what the neighboring islands would do is do whatever they can, give food, give money, and if you couldn't give anything, you will show up. You will help maybe just to weave some mats on a certain day or to help rebuild houses. So the concept of Solidarity is whatever little you can give or contribute in the rebuilding of the lives of your neighbors or whoever is in need, you do that. And I think that's something that that also increased, that we saw the frequency of which happening increase after disasters. Yeah, I also do have some some reports from our village visits as the network AFG and some of the work we've done there. I think I could maybe also attach those to the studies that I mentioned and send that across to Ale, and Ale could share that with everyone. Yeah, I think that's pretty much from me. Thank you so much for having me again. I was feeling so self-conscious. I was seeing all the doctors in the speaking panel and just felt so underqualified. So I'm just sharing from experience what I've noticed, what the work I've done, and I hope that's enough to inform this conversation and also where we're going in the future as COP31 is on the horizon. Vinaka.
Thank you very much, Litiana, for sharing your great talk and insights from the Pacific. I actually, when you mentioned about not really talking about emotions, that made me think a lot about Turkey, because here, especially in rural communities, it's very common to express emotions by not expressing them, but with somatic occurrences, which is a very, very interesting topic that sounds somehow similar, and maybe an opportunity to try to understand more and collaborate on. So thank you very much for all these
Thank you so
insights.
much. Thank you.
And our last speaker is Dr. Alessandro Massaza, who will be sharing with us about COPs as an opportunity for climate change and mental health integration. Over to you, Ale.
Thanks, Jean, and thanks so much to all the previous speakers. I guess often when I work on processes like COP and other multilateral policy moments, it's so hard, I think, so easy to forget about the kind of experiences that these moments, I think, impact and what they speak to in terms of the everyday life of people from all over the world. So I wanted to really thank the previous speakers for grounding, I think, this discussion on COP that can sometimes feel so abstract into their different national contexts. And also it was really interesting, I think, as Celine said, to see how many, I guess, commonalities there are also in the way that people are responding to the climate crisis, but also the very kind of unique ways in which climate is impacting people in different parts of the world. So thanks everybody for that. So I have a couple of minutes just to go through and provide a bit of an introduction to COP as a moment in the climate policy space. And apologies if this is something that people might be familiar with, but I'm really going to start from the basis in terms of what COP stands for. So COP stands for the Conference of Parties, and it really represents the main mechanism of a UN process called the UN Framework Convention on Climate Change, or the UNFCCC. And the reason why we use the term parties within COP is because that's the way in which governments are referred to within the UNFCCC. And parties are basically all of the governments that have signed or have been part of the UNFCCC, as well as or the Kyoto Protocol and the Paris Agreement. So how do COPs work? So COPs have usually three main components. One, which is probably the most important part, is the negotiations, which means that countries come together and they try to reach agreement on certain topics. But then besides the negotiations, you also tend to have a number of other events, whether through exhibitions or side events, where specific topics which should be functional to the discussion of the negotiations can be addressed. Usually what happens is that countries or parties don't really negotiate individually, but they negotiate in what are known as blocks. And this is a bit of an unhelpful, very tiny slide on the right, but it kind of shows the different blocks within the UNFCCC COP processes through which countries negotiate together. And as well as negotiating in terms of blocks, countries also work on negotiating tracks, which again largely means sort of different topics that are being discussed. So you have the mitigation track, the adaptation track, the loss and damage track, and many other tracks such as gender, finance, agriculture, which are discussed at COPs. So one thing that I always find quite surprising is that despite we are really seeing an increase in the level of attention that health and mental health is having within COP discussions recently, actually health has been in UNFCCC decision-making and discussions for a pretty long time. And something that I was surprised to learn about when I started working in the climate and mental health space is that actually the right to health is recognized in the preamble of the Paris Agreement, which is arguably one of the key climate multilateral kind of policy mechanisms on which the COPs are based. So again, from quite the early start of COP processes, we can see how health was already enshrined in some of the key policy mechanisms. And that was in 2015 when the Paris Agreement was signed in Paris. There have been a couple of other key moments when it comes to how health has been integrated within COP discussions. Particularly, we see that the WHO was increasingly being asked to be engaged within UNFCCC spaces from 2015 onwards. In Glasgow in 2021, we had the first WHO Health Pavilion inside a COP. And also we had the launch of a pretty important mechanism within the climate and health space known as the Alliance for Transformative Action on Climate and Health, the ATTACH. And then that was followed in 2023 by COP28, which was a really key moment in the context of health being integrated within COPs, because that's when the first Health Day happened. We had a declaration on climate and health. There was the first ever ministerial on climate and health, in which many ministries of health for the first time attended COP, which is usually a moment which is attended by ministries of health, Ministry of the Environment, ministries of climate change. And so that was a really, really key moment that had very large consequences, I think, on the way in which health has then been mainstream within climate discussions at COP. And indeed, in COP29, that was followed by the COP29 Continuity Coalition for Climate and Health, in which multiple presidencies agreed to really try and ensure that this momentum on health would be sustained across future COPs. So, for example, by trying to have health days across the different COPs and trying to ensure that health is represented within future COPs as well in a formal way. And the last COP, which happened last year, so COP30 in Brazil, again, we saw a lot of attention around health, particularly in the context of the Belém Health Action Plan, which I'm going to briefly touch upon. But focusing, I guess, specifically on how mental health has featured at COPs, I would say that it's fair to say that within these broader health discussions, mental health has probably been one of the health outcomes that has received the least attention when it comes to discussions within the UNFCCC and COPs, despite the fact that, as I mentioned, health was present in COPs for quite a long time. The first ever mental health side event only took place in COP28 in Glasgow, and Emma, who's here in the call, was kind of really key in making sure that that happened. But we have seen increased amounts of interest in then future COPs following the COP26 side event. Having said this, there is a really interesting study that was done by Omnia Olamrani, looking at how many mental health actors have actually participated in COPs. And what they were able to identify was that there were only 49 mental health actors that had participated in COPs between the first COP and COP28. And if you look at what percentage that is of the entire health community, that's less than 1% of the health community being represented by mental health actors, which I think is a pretty significant sort of like sign of the fact that mental health is still being underrepresented within discussions on health at COP. I'm just going to touch on a couple of key political outputs from COPs that have mental health inside of them. So one of them is the Declaration on Climate and Health, which I mentioned coming out of COP28. And this, again, was a really key political output. It was endorsed by more than 140 countries. And really, for the first time, we had mental health and psychosocial well-being being recognized as a key component when it comes to thinking about how we can comprehensively respond to address the impacts of climate change and health. Another really key document, which again I mentioned coming out of COP30, was the Belém Health Action Plan, which was a document co-written by the World Health Organization, the Pan American Health Organization, and the Ministry of Health of Brazil, which really tried to outline concrete ways in which health can be integrated into climate adaptation discussions. And more broadly, how can we try and ensure that our health systems are adapted and resilient to the impacts of climate change? For mental health, this is a really important document because it's really the first time that mental health was so comprehensively highlighted in the context of a COP output. So if you look at the Belém Health Action Plan, you will see that there is a whole section dedicated to thinking about how can we integrate mental health into climate adaptation. And there's a number of concrete and specific actions that countries can commit to when it comes to actioning these suggestions. So things like integrating MHPSS in national plans, strengthening the resilience of our mental health systems, more research monitoring indicators, and also training the workforce in MHPSS response. So this is really interesting because usually when we hear mental health being mentioned in the context of COPs, it's often very general, it's about impacts, it might be mentioned in passing, whereas these are very specific and concrete actions that countries can commit to when it comes to their engagement with mental health and climate. And the final policy output that I wanted to mention is something known as the Global Goal on Adaptation, which was a mechanism that was already written within the Paris Agreement. And it's a mechanism through which countries can monitor how they're adapting and preparing to climate change so that they can track progress on climate adaptation. There has been a lot of discussion around how to do that because adaptation is obviously very local, context specific. So it's quite tricky to have one single indicator to track progress on adaptation. So what countries agreed to is to have a suite of indicators. And at COP30, they agreed on 59 indicators. And one of these indicators is an indicator specific to mental health. And I've put the wording here on the right, but it reads as the proportion of the population vulnerable to climate change with access to mental health and psychosocial support. And this is really important because it currently really is the only formal entry point for mental health within UNFCCC processes. Where we are at is that countries will now have to start to monitor and operationalize and track this indicator. And this is not an easy task because, as you can imagine, different countries have different ways of monitoring mental health. They might have different levels of data availability on access to MHPSS. So it will be interesting to see how different countries address this indicator differently. And these are discussions that are very much active and that will probably happen between now and the COP32 taking place in Addis Ababa in Ethiopia in 2027. So just to conclude on COP31, as many of you will now know, this is a slightly unusual COP because it's being jointly led by two different countries, Turkey and Australia. Turkey is the host country, so it's going to be responsible for the actual hosting of the COP logistically and operationally. It will appoint a COP31 presidency, but also importantly will be responsible for the COP action agenda, which is often where the health discussions take place. So things like the Health Day, the Belém Health Action Plan, the COP28 declaration, they all come out of the COP action agenda, which is the agenda that is responsible for looking at how the negotiations can be translated into action and can be implemented. So again, Turkey will have a very important role when it comes to featuring health within the COP agenda. Australia, on the other hand, will be leading the negotiation, then there will be the presidency of the negotiations. COP will happen in Antalya in November, but there will also be a pre-COP in Fiji and Tuvalu, with a site visit to Tuvalu in early October in 2026. And to conclude, the health priorities at COP31 is that we will likely have a health day. The date is still to be confirmed. From what I've understood, Turkey doesn't seem to be necessarily keen on creating something completely new, like a new declaration or a new action plan, but potentially to ensure that what has already been agreed on is followed up and translated into implementation and action. So for example, thinking about, we have all these amazing actions within the Belém Health Action Plan on mental health. How can we ensure that we actually start implementing them and translating them into action? Having said that, health has been one of the 10 priority areas for the Turkish presidency, and health has been framed as dynamic and resilient health systems. And I think initially Turkey didn't include health in its 9 pillars, and it was a sort of last-minute addition that health made it through, and that was also because of strong civil society pressure for ensuring that health was represented. So I think that's a big win for the civil society space in this area. And I've just highlighted the more specific priorities that the Turkish presidency has highlighted when it comes to health. And again, it's things like health infrastructure, risk assessments, early warning, digital and AI, health workforce, and One Health, which is a topic that is increasingly receiving quite a lot of attention, but also cooperation and financing as key topics of interest. So I think that's everything on from my end, and I'll probably pass it over then to Bron and Celine in case people have any question, either for this segment of the presentation on COP or for anything else that has been mentioned by the other speakers previously. So back to you, Bron and Celine.
Wow, thank you so much, everybody, for these incredible presentations. I already feel like it's so informative and will help us really shape our contributions. I'm already thinking of shared messaging and focus areas, but we have about 10 minutes left in our call together today. So really just opening up the floor for sharing questions, perspectives, comments, really. So I'll just pause and over to you, everyone. Yada, go ahead.
Yeah, I was going to say about the first presentation. All the presentations are perfect, by the way. I love them. And something come to my mind about like the basically about the traumas and stressors. They are also spreading amongst people as well. Like when someone experiences something, it just spreads towards the other person. So it's like kind of contagious, right? Isn't it? Like I felt this a lot during the speeches. And also about the 1 minute. About like it depends on the culture how we express. I realize like yes, we experience through somatic ways, and also we experience towards like when someone says something to us, we get so affected emotionally in Turkey wise, especially like and there is so much like talking and around these subjects as well, as I feel like there is so much awareness increasing as well, which is good in a way. I just want to add these points, and that's all I can say, I guess. But thank you very much for everything, and I'm so happy to be here. Yeah. And who can? Someone? Emma. Yeah, Emma. Yeah. What was yours?
Yeah, thank you. I just wanted to come back and to say thanks so much for sharing that. And I didn't really introduce myself at the start. I realized I was trying to juggle between my laptop and phone and was aware of time. But I'm Emma Lawrence, and I'm currently in Oxford in an unusual record-breaking heat in the UK. But I'm from the lands of the Kaurna people in Adelaide Hills in Australia. And having led a project called Connecting Climate Minds, as I mentioned before, where I got to work with many wonderful people around the world and hear from people around the world, exactly as you're saying, you know, distress is kind of universal, but the kind of cultural expressions of it differ. And you know, we talk about mental health, but so much of it is expressed in our bodies, etc., as well, and how that shows up for people, how that's expressed. You know, we really needs to be understood, and we heard so beautifully from our wonderful speaker from Fiji how, you know, when essentially what we heard from many peoples, that how when the land is well, you know, we are well, and vice versa. But I think also, while the climate crisis is breaking some of those kind of cultural practices are under pressure, lands are under pressure, is also a great source of resilience. I think it's we heard, and it's so important that the points that were raised around the power of culture, the power of community, as a healing force as well. And we see that in evidence, even in Australia, on caring for country initiatives being good for the environment, but also really good for mental health and well-being. And I've heard from people how, you know, someone was saying that actually some of their favorite times were growing up were after like community struggles, because the communities would all come together and they would share food and they would, so it was also like a as a child, this sense of warmth that was created in the midst of adversity. And so I think there's huge power in that. So thank you for sharing. And just wanted to say that, yeah, what you're sharing has sort of echoed, and I think just we can all come together in that way. There's a lot of strength.
Sibel.
Just following on really from some of what's been being said and what Em was saying. So I'm trying to look at the camera because I put the screen up there. But I was really struck by the presentation that you gave, Litiana, and by the parallels in that with what I've been learning working with Uncle Dean Kelly and Auntie Rhonda Dixon Grosvenor and Auntie Kalida Murray, who are three Aboriginal elders and knowledge keepers. And one of the things that really struck me was that, sorry, I've also been involved in some media today, was that phenomenon of actually recognising that there's a real change going on and that human community needs to respond. And Uncle Dean sharing with me this idea that, in fact, that was really well recognised by people who were in contact with their culture among First Nations people in Australia, but that lots of people like me just kind of, our culture and our context was just not recognising that, in fact, this was this huge thing happening and that we actually needed to. Anyway, I'm probably rambling a bit, but I just was struck by how there seemed to be some synergy in that learning and really appreciate it. Thank you.
And just echoing that, Litiana, there was great interest in your Fijian term. If you could write that in the chat for us or somehow, it's almost feels like a bit of a motto really in terms of how we could complement our offerings at COP. This, you know, we can fit in with some of the things in the Belém Action Plan. I can already see where we fit in, but really focusing much more upstream in community and psychosocial interventions in community by community. And, you know, yes, we need to equip the mental health sector, of course, but we need to equip community who are already there. They're already the first people that you reach out to, are your neighbours and your friends. And how do we really boost that as the major protective factor for mental health and wellbeing? So some really beautiful storytelling there. Thank you so much. Emma.
Yeah, sorry, I know I've already spoken. Just briefly in the context of COP, one thing that has been a point of challenge for a while is actually protecting the mental health of people at COP, especially youth and children representatives, people from different communities who are being brought into the space and sometimes, you know, have mixed experiences. And so this has been discussed for a while, but at the last COP, there was, led by Hashita from Youngo, the youth arm of the UN, developed a space for people to come and have kind of a space to take care of their own mental health in the context of COP, which was super oversubscribed in a sense. And so creating that space, people kind of flooded in. And just to say that in this context, maybe that's something this group can think about as well. I know there was, you know, keen to see if that kind of thing could be taken forward again.
I think that's a brilliant idea, Emma. And we would just note that with how we can maybe help coordinate with organisers, even just having quiet spaces. Like many conferences these days are having reflective spaces for neurodivergent people, et cetera, et cetera. I think that's a really great offering. We could also do some climate cafes or some other kind of care workshop, something. Birchin.
Yeah, I echo. I think that's so important to think about those individuals coming in. I just want to remind, I think we talked with several other members in this group, but we've been thinking also about in addressing this buddy system with Turkish colleagues, young people, and connecting them with others that are coming from different regions, so that they would have, it's a great way of building relationships and bonds and community, but also a way to support the mental health. And I mean, I can only imagine for a lot of people coming to the foreign country where they don't speak the English or so on, there could be also support in different ways as well.
So incredible. Litiana.
Great. I just wanted to focus from the two of you, especially Emma, on the space at COP for the attendees. So I don't know if any of you have heard of Plum Village and Christiana Figueres. She invites climate advocates and everyone in this space to take some time off I think she goes around each region and invites people from the climate space to attend these retreats, and they're wonderful. And I was thinking if maybe we could somehow weave some of these meditation, breath work, deep listening kind of sessions, if this could be an idea for this space at COP, perhaps. And also, so aside from my NGO work, I also am part of the Heart of Yoga Foundation. It's an international foundation, nonprofit that offers non-dogmatic, really traditional, breath-focused yoga to communities and schools, and they're implementing this yoga for schools program in New Zealand. Anyway, so they have a yoga for activists kind of workbook, workshop kind of material that I feel I could share that also with the group, if that's something that could benefit everyone as we think of things to offer at COP. Panaka.
Oh, so beautiful. So many incredible ideas and offerings, and let's keep them flowing and add them into our notes as we go. And just an acknowledgement that we've all been here listening and learning and feeling. All of our mirror neurons are being fired up. I certainly had a few tears in my eyes at certain times, and just to sort of take this opportunity to acknowledge that we are all experiencing and feeling this, even as we're in our heads learning. So just really encourage everyone to take a bit of a moment and transition from wherever you are in your day, following this screen time. Hopefully you can turn the computer off and take some beautiful, deep, nourishing breaths. Have a cup of tea or water or food, just something that's really nourishing. And I'm really proud to be part of this group and to be working alongside all of you. It's such a privilege. So sending lots of love and gratitude to you all as you transition out of this workshop. And thank you so much, everyone, for being here. And with that, we say farewell for now until our next group.
Thank you so much.
Thank you so much.
Thank you.
Thank you so much. Bye.
Thank you. Thank you. Bye-bye.
Bye, Sita.